Chapter 57, Emergency Preparedness. So first thing you need to do is understanding medical emergencies. So most of the emergencies that you will see do not actually occur in the medical office. So your role as a medical assistant is vital in educating your patients on different ways to combat those emergencies. Some of the emergencies that you may have, you might be able to save a life, you can reduce the pain, you can also prevent further injury, you can reduce the risk of permanent disabilities, and increase their chance of early recovery. And then when you are educating yourself or your patients on how to prepare for emergency, there is a law called the Good Samaritan Law, which will protect you and anybody else who performs a medical procedure in an emergency case from being sued. So you can have little or no training, but if you do decide to help somebody, you can't be liable for anything that will happen later on. So that's kind of the gist of what the Good Samaritan Law is. So preparing for a medical emergency, this would be for you and for your patient education as well. So you want to make sure that you're performing first aid if possible. Obviously, you want to call 911 or the EMS system, and you want to be able to make sure that you are assisting them as well as you can, speaking clearly and calmly to anyone on the phone. And you need to make sure you're providing following information: your name, your telephone number and location, the nature of the emergency, the number of people in need of help, condition of those patients, summary of the first aid that has been given prior to the EMS getting there, and directions on how to locate the emergency. So what this means is most of us have cell phones now, so yes, they can track your location via your phone, pinging off of the different cell phone towers. However, it will ping you if you're in your building on the 4th floor. Sometimes you're going to have to give them that direct location, like building A, floor C, go down the hall and make a left. Especially if you are, in a busy area, what have you like that. You want to make sure you're giving them as much information on where to find you or the emergency. And then you want to make sure that you're not hanging up on the dispatcher unless they give you permission to do so, because they might ask you for some more information that is not noted on this slide. And you want to be able to make sure that you're giving them as much information as possible. So this slide is just the different type of first aid essentials that either you can have at home or you want to tell your patients to have at home, in your car, in a first aid kit, something like that. So some of these aren't 100% necessary, but some of them are. You want to make sure you have vinyl gloves, some Band-Aids, some wound closure strips, which are kind of like the butterflies. If you have any burn gels, you want to make sure that you're having the low adherent dressings. They're a little bit different than regular Band-Aids because they don't have that sticky solution. So when the patient goes to take off that dressing, it's not going to stick to that open cut. The antiseptic wipes, if you, alcohol wipes, anything like that, baby wipes can be used as well. You want to make your gall swabs, which are down here. These are just your little 2x2s. Your surgical tape, you can have some eye wash, which is usually a saline solution that if something does get into your patient's eye, they can wash it out. You can have some medium dressing. These are kind of like your ACE bandages, a little more a little bit more of a tension that you can wrap around it. You can have your safety pins, which can help tie different articles onto your clothing, and then your scissors and tweezers. There are some other ones on here that you can take a look at. The Brave Little Star stickers could be for your little patients, your pediatric, to kind of make them feel a little bit more substantial. They're also called your autocollants, which kind of just help stop the bleeding. Your forehead thermometer or an oral thermometer, either one could be, suffice just the same. So when encountering an emergency, you want to make sure you're doing an initial assessment. You want to make sure that it's called DRABC, so it's, and your save your life. So the danger, any hazards to yourself or bystanders, you want to make sure that you're putting your personal safety first. Your response, is the casualty unconscious? If they are unconscious, shout for help, but do not leave their side. Checking their airway. You want to make sure that you're tilting their head back and lifting the chin. Check for breathing. They should be breathing up to about 10 seconds for normal breathing. And then circulation. You want to make sure that if you have to, that you are able to perform CPR and then use a defibrillator if the victim isn't breathing. You will learn how to do CPR and use the AED in a later lab comp at the end of the semester. So, and that, again, in-person emergencies, just form a general impression, check their level of responsiveness, their CABs, which is their circulation, breathing, and airway. Determine the priority of the urgency. You know, how important it is that they get to the hospital quickly as possible. Conduct a focused exam and document history. So you want to make sure you're starting at the top of their head and going all the way down to their feet, and then documenting anything that you see that is not normal. And then again, if a patient's calling on the phone with their emergencies, you want to make sure you're triaging it, which makes you kind of classifying their injuries from the worst to the less severe. Making sure that you're staying calm, reassuring the patient, and act in a confident, organized manner. If you're staying calm and organized and your thoughts are in order, you're usually going to help the patient to remain calm as well. If you're freaking out and screaming and yelling, that's going to make the patient act a different way as well. So just kind of always try to make yourself stay calm. And your PPE, also known as personal protection equipment. So this will be your gloves, goggles, masks, gowns, caps, and booties. You want to make sure that you're protecting yourself first. So making sure that if you are doing CPR, that you're using a pocket mask or a mouth shield. Making sure that you're, whenever in doubt, just put the gloves on and the mask on. Wear gloves 100% all of the time if you come in contact with blood, body fluids, or mucous membranes. If you have any cuts, make sure that you are wearing your PPE over that affected area. And again, when in doubt, wear more than you think is called for. If any kind of fluid splash in your eyes, nose, mouth, making sure that you're flushing the area with water as soon as possible. When you remove the gloves, making sure you're washing your hands afterwards. Do not touch your mouth, nose, or eyes. Do not drink anything until you have washed your hands thoroughly. And then if you're exposed to blood or other bodily fluids, make sure you tell your supervisor or someone about it. There may be a need for a post-exposure treatment for that. So accidental injuries, you can, this slide here is about your snake bites and bee stings. So for bee stings, you want to make sure that you're removing the stinger with a dull edge object, such as a credit card or something of that nature like that. Do not use tweezers because sometimes that could squeeze the stinger further into and make the symptoms worse. Apply a cool compress, such as an ice pack, once the stinger is removed. It'll help alleviate the pain. And then you can put an antihistamine cream on top, such as Benadryl or Caladryl, something that will help take the itch away. And then elevate the area. Sometimes, depending on where the location of the sting is, it'll reduce the swelling. Now, as you know, some people are severely allergic to bee stings. You will notice if there is a severe allergic reaction, they will feel uneasy, dizzy. Their lips or tongue will start to swell. They will start to not breathe properly. They need to be seen immediately. Most patients do know if they have an anaphylactic bee sting allergy, they will have their EpiPen with them. If they don't, you need to take them to the hospital as soon as possible. Now for the snake bites, you want to make sure that you're keeping the victim calm. Identify the snake if you can by the color, the pattern, the size. Don't try to wrangle the snake, just leave it alone. After the patient has been stung, remove their rings and jewelry. Just in case that area starts to swell up, they're able to get them off prior. Place the bitten part below the victim's heart. That will also help with the swelling. Wash and clean the affected area with soap and water, and then immediately medical attention if necessary. Do not attempt to kill or capture the snake. Do not attempt to cut the area out. Don't block the blood flow. Do not suck out the venom. Give them any food or water by mouth. And then try not to use any holistic remedies that you've heard about on the internet. Anything like that, make sure that you're going to see emergency care tech or to the ER. So I just put a little bit of different images down here. This is kind of what a spider bite looks like, mosquitoes, a tick, bed bugs, and then your bee bites. So another type of accidental injury would be burns. There's different types of burns. There's thermal burns, chemical, mechanical, electrical, radiation burns, and then cold burns. So there's different treatments based off of what type of burn it is. So you'll have your first aid for burns. For all types of burns, immediate first aid response should be removing the jewelry and clothing, run the affected area under cold water, loosely kind of cover the burn with a gauze, a damp gauze, lint-free, or some kind of cling wrap. And if the patient requires pain relief, they should seek medical assistance. When you should seek emergency services immediately, if the patient can't breathe, if the burn is deep, if the face, genitals, or hands has been affected, or the airway, if it's an electrical or chemical burn, if the burn is large in size, bigger than, let's say, a quarter, the affected area is brown, black, or white, and if the skin is leathery in appearance. So these are the kind of the things that you would 100% have to do immediately to kind of prevent any more further damage with infections and all of that. Another type of accidental injury would be your choking. So choking is anything where food or foreign object blocks the person's trachea or their airway. The most common symptom is their ability to not speak. They will have their hands up around their neck as kind of the universal sign for choking. Or a hand up in the throat, and they obviously have a fearful look on their face. Ear trauma can be treat any cut or laceration to the ear by lightly applying a bandage, even with pressure over the injury. Eye trauma, depending on the severity, eye trauma will require more than an ice pack or cold compress, making sure that the retina or the actual eyeball was not affected. And then for falls, if the patient falls and can't get up, you need to call for help. Do not move the patient on your own. Sometimes that can cause more injury. Wait for the EMS or physician to examine them. And then making sure that you're telling the patient to not move their head, neck, or back injuries, which again, that can cause more injury than not. So for the Heimlich maneuver, if you're doing for choking victims, you want to make sure you're standing behind the victim. Place your arms around the victim's waist. Make a fist. Place the thumb side of your fist against the victim's mid-abdomen. Grab the fist with the other hand and kind of push up and in a upward motion into the abdomen, and then keep redoing that process over and over again until something pops out. And then for little people or children, you want to make sure that you're turning them on their stomach and kind of hold them on the foreset of your arm, and then kind of pound your palm of your other hand onto the back of your patient. Now we'll discuss your fractures and sprains. So you have different types of bone fractures. So that has to do with the bone, where the sprains more so have to do with muscles that surround the bone. So your green stick, that's the most common injury with pediatric patients. which kind of looks like just like a little squiggle mark through the bone. Your transverse is completely going across the entire center of the bone here. Communicated means it's kind of like, almost like it's pebbly, it's all kind of smushed up together. Spiral kind of is almost like a green stick, but it kind of goes up the side here. You'll see how it's kind of moving around the side. And then compound fracture is when the bone actually completely separates and it dislocates from itself. And then your type of ankle sprains. So you have your high sprain, which is a little bit higher up the foot, actually. So it's when your foot twists outways. Your inversion ankle is when your ankle rolls outward and then tears that deltoid ligament, which is right here. And then eversion ankle sprain is when the ankle rolls inward and then that foot then turns outward. So these are kind of the different ankle sprains. And then the treatment for those fractures and sprains. Most minor soft tissues can be managed at home. For the first 2 or 3 days, you want to make sure that you are following the Price procedure. So P would stand for protecting it. The R would be resting it. Ice would be the I, which is you're icing it for about 20 minutes off and on every 2 to 3 hours. Do not apply the ice directly to the skin. Put down a washcloth or something to protect it. And then compression would be the C. You want to make sure you're wrapping the area with an elastic bandage or, something like that. And then the E would be to elevate it. You want to elevate the injury by resting it above the level of your heart, which will help with the swelling. So if you're laying down on your bed, put a pillow under your foot on the couch. You can put your leg up onto the top of the couch there. And then same for your arms. Just keep everything above the level of your heart. Okay, so let's define strains, sprains, and fractures. So fractures and dislocation depends on different factors: the nature of the injury, the patient's age, and their physical condition. So a sprain is categorized by partial tearing of a ligament that supports any joint, such as the ankle. A sprain can involve the tendons, muscles, the blood vessels, and any area surrounding that soft tissue. It could be, symptoms would be swelling, tenderness, pain during movement, discoloration. If a suspected sprain is there, you want to splint it, ice it, and call EMS. You may need an x-ray to further confirm that there is no fracture. So a strain is any muscle injury that's overextension. Usually it causes pain on motion. The physician will do the Rice method, rest, application of heat, or muscle relaxant. And then a splint. So that's an appliance used for conditions for rigid immobilization, usually as a temporary measure. They want to make sure that the area is not able to move. And then a cast. It's a harder external dressing, usually made out of plaster or fiberglass, and this is a longer term temporary measure than the splint. You can help assist the physician with the application of the cast. You can also educate your patients after they have the cast on how to take care of it. You want to make sure that if there's pain, swelling, discoloration, that they are letting the doctor know. Keep the cast elevated for the first day or so. You want to make sure that you're keeping the cast dry. Don't do any kind of strenuous activities for the first few days. Don't put anything inside of the cast to scratch it. No hangers, anything like that. And then anything the physician tells the patient to do, making sure that they are abiding by those activity restrictions. And now head injuries. So there are different types of head injuries. You can have concussions, severe head injuries, or hematomas. So your concussion is a jarring injury to the brain. It's the most common type of head injury. Patients may lose consciousness. Their color can get a little light, memory loss, vomiting. Usually those symptoms will disappear pretty quickly, or they can last up to 24 hours. And then severe head injuries or contusions, fractures, any kind of intracranial bleeding, which can cause symptoms similar to a concussion, but a little more profound. Signs and symptoms can be leakage of clear bodily fluids from the ears or nose, seizures. The breathing is either starts to slow down severely. So you can also have concussion symptoms over here. Excuse me. You have your hazy, foggy, groggy feeling, nausea and vomiting, headache or pressure in the head, dizziness, and then feeling confused or trouble remembering things. Some of the do's and don'ts for head injuries. Be extra cautious if you suspect that it's a head injury. Stabilize the head and neck, making sure you're calling for medical assistance there as much as you need. If the patient vomits more than once, that is something that needs to be addressed. Do not move the patient unless they are in immediate danger. Do not apply pressure on the head. Don't pack the ears or nose with anything. And then do not remove any kind of objects that could be sticking out of the head. And then we'll talk about their scalp lacerations. So you can have lacerations, just a little bit of a cuts, and then hematoma is more of a bruise or like a bump sticking out, which can be caused by many numerous things: car accidents, baseball bats, softballs. So it just depends. So you'll have your skull would be here, the force of the object hitting, and then your hematoma, if you see it here, which isn't really a great picture, it's kind of like a big bump that's sticking out from the area. And then how to treat it. Before you treat the room, follow the infection control, making sure you have your PPE on. Cleanse it with mild soap and water. Try to flush out any of the foreign objects that might be in there. Cleanse the skin surrounding the room, and then gently pat the affected area with a clean pad. If it's profusely bleeding, make sure that you do call EMS. But some of them, if they're smaller, you can take care of that situation at home. And then you can have poisonings. So there is a little number here. If anything ever happens with a poison help, it's 1-800-222-1212 or 1222, I'm sorry. So types of poisoning. You can ingest something, which is orally inhaled, which would be breathing in. Most common is carbon monoxide poisoning. Injected, which means it's breaking the skin. And absorption means you're coming in contact with something and your skin is absorbing. Often there is no visible sign of injury of how it got into your body system. So there's just a little tidbit over here on how to first aid for poisoning. For swallowed poisoning, remove anything remaining in the person's mouth if you can. For poisoning in the skin, remove the contaminated clothing using gloves. Rinse the skin. For poisoning in the eye, make sure that you're gently flushing the eye with cool or lukewarm water for at least 20 minutes. And then for inhaled, get the person into fresh air as soon as possible. If that patient, if the person vomits, turn his head to the side to prevent choking. Begin CPR if necessary. And then have somebody gather, if it's like a pill bottle, packages, containers, anything that has a label on it, so that when the poison control or EMS is there, you're able to alert the EMS system of what possible could be the poisoning. And then some weather-related injuries. We're going to talk about cold for a little bit. So you can have cold stress, hypothermia, frostbite, or trench foot. So symptoms of cold stress: shivering, bluing of the skin, paleness, slurred speech. Hypothermia is also shivering, pale skin, fatigue, drowsiness. Their extremities start to look a little bit white. Slow, shallow breathing. Sometimes you can lose consciousness. Frostbite, the skin is cold and it feels hard and waxy to the touch. Numbness in the fingers or the affected area. Swelling, blisters, loss of sensation in that affected area. They can't move it, or dark colored, discolored patches on their affected area. And then trenched foot would be swelling of the feet and toes, cold pale skin, tingling, aching, cramping, blisters, nail color changes or the nail falling off, and then discoloration of the skin, redness, bluish, or purplish patches, or darkening of the skin. And then heat-related conditions. You'll have your sunburn, sun poisoning, heat rash, and heat exhaustion. So we all know what a sunburn is. It's overexposure to the the UV rays from the sun. It can be from mild to severe, redness, tenderness, blisters in some case. Can be between 6 and 48 hours, and if it's severe enough, it can cause permanent damage. To treat your sunburn, briefly apply cold compress or ice to the affected area, moisturize the skin. You can also take a pain reliever as well. Sun poisoning. So this is the extreme sunburn. It can cause internal and external symptoms. Blistering from the skin is usually a big sign. Person can have headaches, nausea, dehydration. These symptoms can last for days or even weeks, depending on how bad the exposure was. A doctor may treat the condition with oral steroids or topical antibiotics. Heat rash can come from your skin's pores being clogged with sweat. When this occurs, perspiration is kind of trapped inside of your body, and you can develop like high friction areas under the armpits, elbows, inner thighs. Usually treated with over-the-counter remedies such as Caladryl or calamine lotion, aloe vera, and ointment. And then heat exhaustion. This happens when you are heavily sweating, you have loss of water in your electrolytes. You become so dehydrated that your body cannot regulate its temperature. So some of the symptoms can be lightheaded, thirst, your heart rate is going insane, weakness, your breathing has slowed down a little bit, your face is really red. If this is the case, you want to make sure that you're finding a cool shaded area, rehydrate. You should also cover your face with a cool wet cloth, take a cool shower, take off your shirt and maybe douse it with nice cold water and then put it back on. And different kind of wounds that you may come in contact with. I have a little image down here of the different types. You have your abrasions, which is like a top layer skin is removed. A laceration can be jagged, irregular edges used by a cut, usually from it's tearing away different parts of the skin tissue. And then incisions, that's usually smoother edges, and it resembles a surgical or like a paper cut. Excuse me. Punctures can be deep, narrow, such as a stab from a nail, a knife, and it sometimes can affect the underlying organs. And then an avulsion would be a flap of skin that is torn loose and is either hanging from the body or completely removed. Sometimes it could, for an example, would be like the chin. If you were to fall down and hit your chin on something, sometimes that little flap of skin can be, torn loose from your body. And then amputation would just be cutting or tearing off of a body part, such as a finger, toe, hand, foot, leg, or arm. And then hemorrhaging. So that's different types of external bleeding. It can also be internal bleeding as well, but we're going to talk about the different types of external bleeding. So you can have abrasions, that's from scraping areas that are on a rough surface. Lacerations, again, refers to cuts on the skin, often from sharp objects, broken glass, and knives. Punctures and avulsions, they happen with a sharp or pointed object that penetrates the skin. And then avulsions can often lead to threatening situations due to serious trauma, such as explosions or motorcycle accidents, like of that nature. Postpartum bleeding can be from after a vaginal delivery or cesarean delivery. And then epistaxis, also known as a nosebleed, an individual faces nosebleeds when the tissue lining inside of their nose starts to lose blood. And then different kinds of common disorders. So this one is about abdominal pain. So it is. Most common causes are pains in the stomach. It could be pain in the intestines, pain in the bowel, usually from constipation, pain in the gallbladder. Usually happens after eating foods that are high in fat. Pain in the appendix would be in the pain is the center of the abdomen, which moves up to the lower right area of the stomach. Pain in the bladder can often be from a UTI, usually as a dull ache or pain while urinating. And then pain in the uterus or ovaries. You can have your ovarian ducts can have an issue with your female patients, non-serious menstrual cramps, or serious conditions such as your ectopic pregnancy. And then over here, this image, some different things that can cause stomach pain. You'll have your GERD, which is usually your heartburn. Your gastric ulcers are affecting the stomach. Gastritis is when your stomach is inflamed. Pancreatitis right here is your pancreas inflamed. Diverticulitis would be when your large intestines are inflamed. Your duodenal ulcer is your other intestine that gets affected, which would be your IBD. Irritable bowel disorders, your small intestines. Constipation is when your stool is a little bit harder and you're not able to have a bowel movement in a nice way, to put it in a different way. And then your appendix would be down here. It's also called appendicitis. Common disorders such as Synacope, also known as fainting or as passing out. There's different types. There's reflex, cardiac, or neurocardiogenic. Some of the causes can be sudden drop in blood pressure, different benign conditions, serious medical disorders, or different drastic hormonal fluctuations. Symptoms can be feeling lightheaded when you're weak when standing, falling for no reason, blacking out, vision changes. And then treatment can be taking the appropriate medications, avoid situations that causes episodes. Undergoing biofeedback training, which means going to the physician, and then treating any kind of hormonal imbalances as well. Other common disorders that can happen, you can have a fever, which is when your body temperature goes above 100.3 or 100.4. Hyperventilation is when you're rapidly breathing, you're not able to catch breath. Usually it's when they're breathing in too fast and they're making that noise like that, so they can't catch their breath. Nosebleeds, obviously, is when your nose is bleeding. Tachycardia would be when your heart is beating rapid or too fast. And then vomiting is when your stomach contents are coming out through your mouth. And then some of your less common disorders. You have your anaphylaxis and your bacterial meningitis. So anaphylaxis is a severe allergic reaction to something. It can be from your skin, it could be hives, swelling, warmth, and redness. It could affect your lungs. It would be coughing, shortness of breath. Gastro would be your stomach pain, nausea, cramps, diarrhea, or vomiting. Cardiac would be dizziness, your pulse is weak, you're fainting, you can have shock, loss of consciousness. And then neurological could be anxiety or impending doom. These can all be some of the symptoms. Causes can be from animals, medication, eggs, bee stings, fish, nuts, things from external environmental aspects. And then bacterial meningitis. That is when the part of your brain that protects your skull, or protects your brain rather, is like a thin little layer called your meninges. This happens when that part of your meninges starts to get inflamed. Usually, this is from a bacterial stance. You come in contact with something that now has affected the meninge part of your brain. It could have a fever, headache, stiff neck, nausea, vomiting, light sensitivity, drowsiness, and skin rash. So some of these do seem pretty common. If you've ever had your menstrual cramps or things like that, a lot of those do seem kind of common to those. But if it's bacterial meningitis, usually you do have your skin rash and vomiting. So just make sure that you know the difference between normal sickness versus your bacteria. This is a definite thing that you need to go be seen by the physician for. And then we'll discuss your hyperglycemia, which is when your blood sugar levels are high, and hypoglycemia. That is when your blood sugar levels are low. So if you see this image here, your normal level of glucose is in the middle. Hypoglycemia is when your blood sugar is low. That'd be that one little white spot there. And then hyperglycemia is when you have more than the amount that you need. So you have too much sugar in your blood. Signs of hypoglycemia: dizzy, sweating, chills, your heart rate is beating too fast. Confusion: what to do? Eat something that has sugar in it, drink juice, eat a snack, and then see a doctor if this continues. Hyperglycemia is when you're going to the bathroom too much, you're urinating, you're extremely thirsty, you're hunger, headache, or you have sugar in your urine. What to do? Drink plenty of water and making sure that you are seeing a doctor. If you are a diabetic, there are different ways to treat that by either giving yourself insulin or giving yourself glucose to kind of counteract the differences between those. And then we'll do your insulin shock versus diabetic coma. So for insulin shock, that's when you need sugar. A diabetic coma, you need that insulin to bring down the sugar levels. So symptoms of insulin shock: your pulse is strong and rapid, your breathing is shallow, your skin can look pale and sweating, your breath is odorless, you can lose consciousness. Other signs could be headache, trembling, or hunger. Diabetic coma: your pulse can be weak, your breathing would be deep and sighing, your skin can be dry, warm, or flushed. Your breath can kind of sound like nail polish, sweet, acetone. Loss of consciousness, gradual versus the quickness to it. Other signs can be nausea, unsteady walking around, which would be dizziness as well. And then this little image over here, diabetic coma is hyperglycemia or hypo. Unconsciousness, dehydration can be fatal if left untreated and only affects diabetics. Insulin shock is hypoglycemia. Your breathing can be rapid and you can feel numbness. You should be treated 100% immediately, and then it also can affect non-diabetics. Your gallbladder attacks is another one of the less common disorders. So we talked about this a little bit before. This is when your gallbladder, starts to get inflamed. Often occurs after you eat a high meal that is high in fat or rich in cholesterol. So you can wake up in the middle of the night with acute abdominal pain. It's usually in the upper right quadrant of your stomach. It could be from gallstones that are obstructing the duct. So that duct then carries the bile to the gallbladder, delivering the bile to the duodenum, which is part of your intestinal path. The pain can radiate from the back into the shoulder blades. It also can affect your epigastric region, which is the central region of your stomach, and it can go towards your chest area. Pain and vomiting, nausea. Sometimes it's so severe that you do need to go seen by a doctor because patients will think they are having a heart attack. So some of the symptoms here is a little image. You have jaundice, which is discoloration of the skin, changes in your bowel movement, nausea, vomiting, your changes in your urine, and then pain in the mid or upper right section of your abdomen. And then your heart attacks or a myocardial infarction. So this is when the blood flow to the heart is reduced, and as a result of that, it could be from blockage to one of those coronary arteries or their branches. Heart attack symptoms: sweating, pain in the chest, arms, neck, or jaw, shortness of breath, and heartburn or indigestions, usually for the men. Now for the females, it tends to be dizziness, uncomfortable pain between your shoulder blades, shortness of breath, indigestion, and unexplained fatigue or sleep disturbances. What happens? What you should do, call 911, start CPR, or use the AED. Professionals then would be the EMS response, hospital care, and then if you survive, you would be the survivor in recovery. Another less common disorder would be VFib, or ventricular fibrillation, and using the AEDs. So what VFib is, if you're looking at this image here, is your normal heart rhythm. It kind of goes the same on each little section here. What VFib is when it's kind of scattered all over the place and your heart's just going insane. It's beating too fast. It's not beating in a normal rhythm. So what an AED will do, or automated external defibrillator, this kind of shocks your heart back to the normal sinus rhythm that is here. So it'll deliver your heart a shock, stop it for a second, and then hopefully it does restore that heart rhythm back to a normal heart rhythm. And you will again be trained later on in the semester on how to use an AED. Some other less common disorders, you have your shocks and seizures. So seizures or convulsion is a violent involuntary muscle contractions, usually caused by abnormal electrical activity in the brain. And then shock, this is usually associated with your cardiovascular system failure. It can stop your normal metabolic functions from working. So what can cause seizures? Alcohol withdrawal, bee stings, brain injury, choking, drug abuse, electric shock, epilepsy, really high or low blood pressure, poisoning, or strokes. And then different types of shock. You can have obstruction shock, is when your blood cannot get to where it needs to go. Cardiogenic shock is your heart is weakened, damaged, and can't pump that blood effectively, also known as a heart attack. Distributive shock, that's when your blood vessels become floppy and they're reducing the amount of blood that needs to go to the organs, also known as anaphylaxis. And then hypovolemic shock. That is when your blood doesn't have enough fluid in it. So the volume is circulating through the body and your organs aren't getting the correct amount of fluid or blood to that specific part. And another one would be stroke, or your CVA, a cerebrovascular accident. What causes strokes? So what a stroke is, it's sometimes called a brain attack. So you can have a blocked artery or a ruptured artery. An ischemic stroke occurs when a blood clot blocks the flow in an artery within the brain. And then a ruptured artery or hemorrhagic stroke occurs when the blood vessels burst within the brain. So you have a blood clot here, and then that brain tissue starts to die, and that will be caused up from a blocked artery. And then a rupture type of stroke is when the actual blood vessel is popping wide open, and it will cause a brain bleed on top of this section of the brain here. What to do in a stroke? Be fast. Balance, eyesight can be affected. Facial weakness, arm weakness, speech difficulty, and time is brain. So making sure you're reacting quickly. Another less common disorder would be your toxic shock syndrome, usually caused from leaving tampons in too long. Symptoms can be, it's a rare deadly disease caused by the toxins in the bacterial and in the bloodstream, often from tampon or menstrual cup use. Symptoms: high fever, sudden drop in blood pressure, dizziness from standing up or sitting down. Prevention: don't wear your tampons for more than 8 hours, and avoid using a tampon that has higher absorbency than what you need. Rule of thumb: if you wear a tampon for 8 hours without changing it, it's too absorbent. So making sure you're just using the light versus the regular, extra, super for what you need it for. If it's not treated, it can lead to seizures, organ failure, or death. And another less common disorder would be viral encephalitis. This is from a virus which causes inflammation of the brain. It's the most common type. Symptoms would be headache, muscle pain, fatigue, fever, confusion, seizures, loss of consciousness, or problems with speech or hearing. Patients under stress and your role to play. So your role during medical emergencies is to keep your victims, yourself, and their families calm. Your first priority at all times is your safety and the victim's well-being as well. Making sure that you're communicating with the victims during emergencies. Victims may not speak your medical language, so making sure you're speaking to them in a language they can understand. If they can't hear or they're visually impaired, use gestures that are used for non-English speaking victims. Continue to speak, however, because they may not be able to understand some English, try to use hand gestures. Tell patients who have visual impairments that what you're going to do before you do it. Maintain voice and touch during the care for them. And then hearing impaired patients, whether they can read lips or not, if they can, speak to them slowly. Never turn your head away while speaking to them. If they can't read lips, communicate by writing, using gestures. And at all times, try to, remain face to face and keep direct physical contact with them. And remain calm. And then disasters and pandemics. You can have different weather disasters, office fires, bioterrorist attack, chemical emergencies, radiation emergencies, and mass casualties. So the actions to take are notated on the other side of the slide here. So whether report the community command, have your credentials with you, accept any assignment for your abilities. Office, make sure you're activating the alarm system using the fire extinguisher. So I'm not going to go through all of these, but you can read the different actions to take based off of what type of disaster. And then finally, bioterrorism. So this is the intentional release of a biologic agent with the intent to harm individuals. So the CDC defines it as a weapon when it is easy to disseminate, high potential for mortality, and can cause public panic, social disruption, and requires public health preparedness. It could be used such as anthrax, smallpox, plague, botulism. During this disaster, it is essential that you remain calm, follow the instructions from the healthcare provider and your local EMS, protect yourself from the disaster, assessing the situation, wearing your PPE, follow the OSHA guidelines. If you will be there with no help in an emergency, you will be of no help in an emergency if you become a victim of the disaster. So always make sure that you are following the standard safety procedures.